And what should have really kind of stuck out to him, this is 2 weeks, man. 2 weeks. Okay? Like, look, first off, if you have dried blood on your scalp for 2 weeks, kind of thinking, did you not, like, try to clean your scalp by any chance? And it follows the same pattern over here, right? You can clearly see that there's some sort of scar tissue that's been built up due to having necrotic tissue in the area. And unfortunately, again, this is due to some sort of bad practice. Again, you can see over here, you have some necrosis lesions as well. You can see the scar that it will ultimately leave behind. Bad, bad, bad. And this is really bad over here. Hello, everyone, and welcome to another video where we look at hair transplants and we kind of just say, what the hell went wrong? Now, I'm going to give you a chance to turn around right now because we're going to be looking at some pretty brutal and, quite frankly, disgusting pictures.
Some viewers may find the following video disturbing. Viewer discretion is advised.
So that's why I'm here on the National Library of Medicine. We're looking at the Stats Pearls page for necrosis. And I'm not going to go through all this nerd stuff. I'll just put it, very simply here. Necrosis is when the cells in the body die or are injured in a way that causes them to break down improperly. And this process is usually due to damage from things like toxins, most likely infections, or really a lack of blood flow to some tissue, right? So when necrosis happens, it can lead to tissue damage because the dead cells release substances that can harm nearby tissue. Now, this is a problem, right? Because if you just get a hair transplant, right, you don't want your nearby tissue to be damaged. You don't want the follicles to be damaged, but especially you don't want the surrounding areas of the scalp where you didn't transplant hair to. You don't want to spread this sort of infection because it's not going to be fun. Okay, so I gave you a warning. Before we go on to looking at the pictures here, don't say I didn't warn you, because now we're going to look at some pretty disgusting pictures. So first off, we're going to go to Dr. William Rassman's website, Balding Blog. He is the hair transplant surgeon who invented the FUE procedure, and I interviewed him on my podcast, the HairStacks podcast. He's also one of the co-founders at Amplifica Holdings, Inc. They're currently investigating Amthera-3, a hair growth stimulant, in clinical trials. In any case, we're looking at some pretty disgusting pictures, or at least one picture over here. And the title of this article from Dr. William Rassman's Balding Blog website is, quote, "Complication of a hair transplant by unskilled provider," unquote. Dr. William Rassman writes, quote, "We are seeing more and more of these types of complications from hair transplant being done all over the world. There is no substitute for skill and experience. What should be a safe procedure is turning out very risky for some people, as shown here. This will require skilled wound care, possibly for months, and the patient will be left with a terrible scar. He could die from such a wound if the infection gets out of control. A high price to pay for a cheap hair transplant," unquote. Unfortunately, you're starting to see this with a lot of dudes who are going to, and gals as well, who are going to hair mills all over the world, especially in Turkey, the country of Turkey, or Turkey. In any case, let's go to Reddit, where we always go to look at some pictures, guys. And would you look at this? This is from the user known as StoryRemarkable2313. What a name, what a name. And it's from Our Hair Transplants, capital H, capital T. That's the subreddit. The title is, quote, "Greetings to all. I want to share my experience with you. A month ago, I had a hair transplant. Immediately after, necrosis occurred. Despite medicines, creams, this condition has occurred. The clinic says that they are not to blame and that my body reacted that way to the transplant, but I am aware," and then it just stops over there, right? So let's have a look-see here. And yeah, that's necrosis, right? You see this dead piece of tissue just staring you in the face, It's right there. There's also some other necrotic lesions. This is pretty small, but this is this is pretty bad. Not only do we have necrosis, but we also have some inflamed skin in the area. Now, you can possibly expect to have some sort of inflammation after a hair transplant, but this is not looking good, especially when you couple it with the fact that there is some necrosis. We're going to be looking at this article over here titled, quote, Recipient Scalp Necrosis, a rare postoperative complication of hair transplants, unquote. And we can see over here, there are some various instances, I'm just going to scroll past this real quick, where they mention how insufficient blood supply, right, and having too many follicles in a particular area, densely packed in a particular area, can contribute to potential necrosis, right? Each follicle is vying to get some blood supply, but when you do this in a limited area, it can really stress out the skin, and if there isn't enough, pathways to providing sufficient blood to the follicles, it can cause them to become necrotic and ultimately die, and then an infection can kind of break out due to the harmful substances that dead cells give off, right? And this can influence local tissue and ultimately, again, cause necrosis. Now, you can see how some of the images here are pretty brutal, right? But look at what happens at the end of, of a necrosis kind of outbreak. When all is said and done, you have this huge scar that's left behind, and unfortunately, the hair is not going to grow from that scar. It's just going to be a very, very bad scar, and you might end up causing a bigger issue than you had before, right? If you had a bald patch, now you're going to possibly extend the region of that bald patch even more due to initiating a instance of necrosis. So you have to go to a surgeon who's skilled enough not to, stress out the local blood supply. And that's pretty much it. There are some bacterias that can contribute to having necrosis as well, right? Think about this. If they don't have clean tools, right, instruments for their procedure, for the hair transplant, whether it's FUT or FUE, it can cause necrosis. And you can see it over here, right? A particular bacterium is responsible for his necrosis. That's really, really bad. Awful. Again, you can see over here, you have some necrosis lesions as well. You can see the scar that it will ultimately leave behind. Bad, bad, bad. And this is really bad over here. This necrosis is just so widespread across the scalp. It looks like it's following a pattern of an FUE procedure. And look at the pus that it brought out. Awful. Awful stuff. And if you're eating, well, I'm not sure why you'd be eating during this. Maybe you're kind of a freak, but aren't we all? We're looking at dead skin cells after all. So going back to this guy, looking at the comment section, everyone's asking him to share the name of the clinic that he went to. People are like, it looks like the original poster doesn't want to share the clinic details. I suggest we downvote this post and not give advice unless he tells us. And honestly, people are saying that that's not that's kind of a dick move, and the guy's not comfortable sharing. But let's be real here. You should be sharing. Again, we have false necessary 554, a doctor who is also, I think they're hair transplant specialist as well as a dermatologist. And they're essentially saying that, this can be removed. This wound can be removed quite easily, but they would have to go to a specialist to do so. So that's pretty much it. This OP didn't post anything else at the time of recording this video. Of course, it is February 23rd, 2025. And this will be posted in the future. Okay, let's go on to the next post here. Over here. This is from the hair transplant subreddit. Just hair transplants, capital H, lowercase t. And we're looking at this post titled, quote, Day 16 Progress Necrosis, question mark. Hi all, just looking to see how you think my progress is getting on and if those two areas are possible necrosis. We're not going to read all this, but they do say that they had around 2,200 grafts for their hair transplant. So let's have a look-see over here. Let's see if this is some necrosis. And, we don't have to look that hard. If you have eyes and if you're looking at the screen, you can clearly see this is an instance of necrosis. Now, some people might mistaken this as a scab, but if we're going to be honest, if you can see why it's necrosis, look at how deep the wound is, right? If it's a scab, you're going to have the scab, of course, perhaps on top of the skin a bit, right? And obviously, this isn't going to be a 100% thing. Don't take my word for it. Go get checked if you think you have necrosis, of course. But scabs typically are like sitting on top of the skin. They're kind of just like above the skin a bit, right? But you can kind of see there's depth to this, right? This is a wound, and within the wound, you have this sort of necrotic dead tissue, this deep black tissue, and around the wound itself, it's discolored. Um, yeah, this is necrosis, right? Unfortunately, this guy has an instance of necrosis. Now, it isn't too bad, but he should act quickly because you don't want to just leave this alone. This necrosis can spread, right? It can, who knows, it can possibly comprise the entirety of the hairline, or it can reach towards the mid scalp if he's not careful. So he has to get this treated properly. He has to go to a dermatologist of some kind who can help him out. But yeah, unfortunately, he has necrosis, but it isn't too bad. Honestly, it's going to suck because it's highly, highly likely that in these areas the follicles are gone. They're dead and destroyed. So, yeah, let's move on to the next post. Over here on the subreddit hair transplants, it sounds like I'm saying the same subreddit over and over again, but now this is hair transplants with a capital H and a capital T, respective to the beginning of each word, hair and transplant. Now, the title of this subreddit post is Hair Transplant Complications. The OP says, quote, 2 months post-op. They say that they have a hematoma / necrosis and secondary healing following anesthetic injections. Now, guys, just like this dude over here in the comments who says, what the frick happened, or WTF happened, right? I'll say the same thing. What happened here? Well, this original poster is saying that I guess the clinic is telling them that it has to do with the local anesthetic injections, and that could be the case, right? If the instruments aren't clean themselves and they're using it to inject it into your scalp, obviously it's going to deliver some harmful microbes into the area, and it can mess up with the skin's healing process, right? You're making wounds when you're doing a hair transplant. You're opening up tissue, you're going pretty deep into the tissue to transplant that new hair. If you're introducing bacteria, and especially if you're not using sterile equipment, of course you're going to have these issues. And unfortunately, he had quite the issue. This guy's transplant looks really bad, on the other hand. Okay, so I want to say that it looks like he had a moderate amount of hair placed in his bald area. I'm going to assume he was like a Norwood 7. The hairline looks okay, but obviously it's the midsection where you have this necrotic tissue, and then this huge island, a couple meters behind the forelock area. You can see over here. Yeah, this is really bad, right? Look at this. This is just very deep into the tissue. Very deep. Over here, you can see where the necrotic flesh kind of popped off, and you can see the flesh of the scalp. It looks really disgusting. For whatever reason, it reminds me of pizza. I don't know why. But you still have other sort of bits of necrotic tissue. And over here, finally, in the last panel, sure, it's healed to some extent, but you can see in that same sort of pattern where the necrotic tissue was, what happens typically, right? It leaves scar tissue. You also had instances here in the first panel where you can clearly see some necrotic lesions as well, or lesions. There we go. And it follows the same pattern over here, right? You can clearly see that there's some sort of scar tissue that's been built up due to having necrotic tissue in the area. And unfortunately, again, this is due to some sort of bad practice. It's rarely the fault of the patient. It's usually the hair transplant specialist. Sometimes patients don't have proper, habits when it comes to cleaning their scalp. Sometimes there's going to be some sort of freak accident where an infection might occur. Maybe, after the hair transplant, the patient walks outside, takes off their cap for just one moment, and a bird shits on their scalp. Well, that sucks, but that's life. And that's something that can kind of, mess up with the healing process. But usually, to be serious here, usually it has to do with something happening on the clinic side rather than the patient side. This is just unfortunate, right? And again, some of those factors, it can be maybe they put too many hair follicles in a particular area, and those follicles are all kind of vying for the same limited amount of blood supply in that particular area. And that can cause some of the tissue to die, become necrotic. Maybe it could be the instruments, again, the tools that were being used for the transplant procedure, the hair transplant procedure, were not sterilized. That could also be a major contributing factor. It could be a host of many things, but at the end of the day, this is just a very unfortunate outcome. This hair transplant failed. And also over here, again on the hair transplant subreddit, capital H, capital T, respective to the word hair and transplant, we have this post over here. 2 weeks ago, post-op, what should I do about the dried blood? Well, I hate to break it to you, Unk. Let's have a look-see here at your scalp. This is not dried blood, nor is it a birthmark. Kind of like that one Soviet leader. Forgot his name. He had that little birthmark over there. But in any case, this is necrotic tissue. All this is not dried blood. This is necrotic tissue. And what should have really kind of stuck out to him, this is 2 weeks, man. 2 weeks. Okay? Like, look, first off, if you have dried blood on your scalp for 2 weeks, kind of thinking, did you not try to clean your scalp by any chance? If you think it's dried blood, did you not try to clean your scalp? Did you not try, a method of cleaning it up a bit? I don't know. But in any case, it doesn't really matter because it's not dried blood. It's clearly necrotic tissue. And again, this hair transplant obviously is going to fail, and it has obviously failed as well, right? You can clearly see, look at this. These are major necrotic regions with small dots of necrosis throughout the areas of the transplant. Unfortunate and very unlucky, but that is the circumstance he finds himself in. Going to the comment section, there are some nice citizens here. Buttery Squid 69 says, I don't want to scare you, but I advise you to see a dermatologist immediately to make sure that isn't necrosis. The OP responds, okay, thank you. Yeah, this is necrosis. And again, when you guys have this issue, please don't sit around, don't wait. If you're noticing that your skin is looking kind of weird, it's becoming very, very dark, and it's probably smelling bad too in the process, don't wait, right? Go to the dermatologist immediately. Try to remedy that as soon as possible. If it's a factor of a bacterium of some kind that's causing that issue in the area, they can give you antibiotics. Now, if it's a factor of this, just, there being too many hair follicles in a given area, well, unfortunately, you kind of have to just wait for them to die out. Because there's not much they can do. They can probably try to take out some of those follicles, but it's probably best to let the tissue kind of die out and manage it with some sort of antibiotic, maybe a topical antimicrobial kind of serum to kind of remedy the necrosis, right? From not getting worse, from not spreading to the entirety of the scalp. And also, going to a doctor to check and make sure you're not actually getting that necrosis systemically, because that can also cause issues as well. Kind of rare when it comes to that part, but nevertheless, it can still happen. In any case, guys, that's pretty much it for this video. I guess we have another one over here. I didn't look at it, but honestly, this one looks more like a scab a bit. This might be a good comparison, actually. The reason why I say this is a scab is because it's sitting on top of the skin, right? If this was inverted, then I would think it's necrosis, but I think it's a scab because, as you can see, it's raised and it's above the skin, implying that there is some sort of layer that it's protecting where the hair is kind of healing there. And even if there's a scab in an area, right, that doesn't mean, the follicles there are damaged. So if you have a scab-like appearance like this, it's most likely not necrosis. This is not necrosis, right? As compared to, let's bring up another image. As compared to this, right, where you can clearly see it being kind of inverted going into the scalp. If anything, the depth is that the dead region of tissue, right, is like damn near in the scalp as opposed to sitting on top of it. So that's kind of like how I, in my opinion, distinguish between a scab and necrosis, right? See this? This is probably a better comparison. This is not a scab. This is necrosis. You can see that because it's going into the skin. This is more likely to be a scab because it's on top of the skin, right? But that's pretty much it for this video, guys. Please, please, please go to a skilled hair transplant surgeon, hair transplant clinic. Don't cheap out. Don't try to, do anything fancy in regards to getting too many sort of hair in a particular area, getting too many grafts in a particular area, because that can cause issues. Now, if you're interested in learning more about hair loss recovery, maybe looking at certain treatments or coming up with a stack, maybe getting some studies so you can talk about it with your doctor. I do hair loss consultations. I'll put that link in the description below. You're welcome to kind of sign up. It is a paid service, and yeah, we can talk about things, and we can help, come up with a sort of comprehensive line of treatment that you can talk about with your doctor, of course. I'm not a doctor, but I've read a lot of literature, and I can kind of help you look through the literature as well and get you up to speed so you can be more informed with either your hair transplants or maybe any sort of like therapies that you might be considering. So again, please check that out in the description below, along with the sources as well. And guys, be safe out here. Don't go to any hair transplant clinic. It'll ultimately cause you issues. Anyway, see you in the next one. Bye, guys.